Good day, everyone. Thank you for setting aside some time to listen to this clip, where I will speak in some detail about the personality trait of Machiavellianism as a pathological trait, especially in its philosophical, psychological context, namely about Machiavellianism as a sort of indication of potential personality pathology that is particularly philosophically significant. Now, what is Machiavellianism? Machiavellianism was developed or invented or formulated in the 1970s by the psychologist Richard Christie, who found that the previously elaborated and well-known in literature dark triad or black triad, a complex of personality traits that make personal organizations particularly toxic, might be supplemented by a fourth personality trait, namely Machiavellianism. And ever since the mainstream literature speaks about the dark tetrad, so the four toxic personality traits in place of the previously discussed three, namely the initial three were psychopathy, narcissism, and sadism, and the fourth one is after Christie's formulation of Machiavellianism. The fourth one became Machiavellianism. So narcissism, psychopathy, sadism, and Machiavellianism. Now, what is Machiavellianism? It is a sort of value system adopted by the person, which reflects what is somewhat superficially interpreted in history of philosophy as the political views of Niccolo Machiavelli, who used to be a political philosopher and advisor to various European rulers, and who is believed to have rather one-sidedly recommended to rulers to pursue policies that would result in their maintenance of their power and the rule of a society, regardless of the ethical and broader universalist value considerations that might apply to those policies. Thus, Machiavelli, among other recommendations, suggested to rulers to manipulate the public, to conduct populist policies, to make friends with other rulers and influential individuals who could help them maintain their power, to not basically refrain from wrongdoing for the sake of needing to be on the right ethical side of policy, but rather to try not to be caught if they conduct and when they conduct such wrongdoings and when they engage in ethical transgressions, etc., etc. So the classical manipulative instrumentarium of policies that populist leaders have used ever since. Now, the Machiavellianism as a personality trait is simply a propensity of the person to engage in such Machiavellian strategies to advance in society. And one particularly clear example of this type of strategy is a situation where, rather than trying to advance in the hierarchy of competence, and rather than trying to attain new abilities and new capacities within the society in order to become a more valuable member of any particular community, the person chooses to seek manipulative ways to advance one's formal status without at the same time increasing one's competence. So that as the end result, one gets a situation where somebody is in a relatively high hierarchic position of authority and preeminence in society, whilst at the same time being very low on the society's ladder of competence, on the hierarchy of competence. Persons who engage in Machiavellian strategies tend to seek status rather than competence. They seek media exposure rather than engaging in rigorous and in-depth study of their subjects. They seek political positions and promotions rather than delving into the actual issues that, as politicians, they ought to resolve and deal with, etc., etc. So Machiavellianism is a fairly well-known strategy from everyday life, and when a person is particularly high in psychological tests and psychometric tests on the personality traits of Machiavellianism, then this is an indication of heightened risk of personality disorders as they are traditionally diagnosed. Now, one of the problems with Machiavellianism is that it particularly clearly reflects the relationship between psychodiagnostics on the one hand and ethics on the other hand. Namely, the dilemma about the diagnosing of Machiavellianism as a disorder arises from the accepted criteria for psychodiagnostics, one of which is that the person needs to face difficulties in everyday functioning. They need to feel pain. They need to be hindered in the interpersonal relationships. They need to suffer in order to show up for a psychodiagnostic interview and to seek help. Whereas many persons who could be described as having personality disorders don't really feel any pain. They don't really feel that they are hindered in their social functioning, and the persons who suffer from those personality disorders are others, they're victims, not themselves. So this is particularly the case with Machiavellians. Machiavellians use others to attain their ends, and they often do so very successfully. In fact, Machiavellianism is so widespread, similarly to narcissism, that it is now really the question for cultural studies and for psychology whether both Machiavellianism and narcissism are becoming the new normal. And thus the Machiavellians and narcissists don't really encounter many obstacles in their social interactions. They're often appreciated by others, they're often promoted, they're often loved by others, because the culture that promotes Machiavellianism and narcissism socializes many young people into actually adopting the values of narcissism and Machiavellianism as desirable resources for social success. So the question here really is whether Christie's articulation of Machiavellianism as a toxic and potentially pathological personality trait really illustrates the truthfulness of an old tradition, relatively old in the young discipline of psychotherapy, one formulated by the French psychiatrist Philippe Pinel, the founder of modern psychotherapy, the modern clinic, who argued that any kind of psychotherapy is a moral re-education, that basically personality pathology is always a moral pathology, and the articulation of Machiavellianism as a pathological personality trait really enforces and reinforces that kind of view. And if so, this leads to an array of questions about how philosophical psychodiagnostics is inherently, and to what extent we can treat immorality as an illness, as a pathology, and if we decide to do so, whether treating immorality as an illness implies reducing or denying the inherent responsibility of the immoral individuals, or is, as Freud believed, is a mental illness, a process and a situation which does not necessarily exclude the moral responsibility of the sufferer. So all of these questions need to be addressed in more detail, and Machiavellianism as a toxic and pathological personality trait is perhaps the most obvious call to action to conduct this examination of the basically ethical nature of at least personal psychopathology, personality psychopathology.